Good morning, everyone, or good afternoon or evening, depending on where you are dialing in from today. My name is Maya Sisla, and I'm Deputy Director of the Aspen Tech Policy Hub. For those of you who are new to us, the Aspen Tech Policy Hub is a Bay Area-based policy incubator training technologists on how to engage with and improve policy. I'm thrilled to welcome you to the second of 3 webinars releasing products from our COVID-19 Challenge Grant Series. We launched our COVID-19 Challenge Grant Series in early April when we saw that there was a potential for technologists to contribute to mitigate some of the negative effects of the pandemic. We funded 6 projects in total with these challenge grants, and today's webinar is presenting 2 of those 6 projects. The thread connecting these 2 projects today are those that help us better measure and understand risks that have come up during the pandemic. This includes risks from virus transmission itself, as well as risks from other consequences, including misinformation. And today's projects are aimed at building informational understanding and response in these pandemic conditions. Before we get started, I wanted to give a brief run of show. The 2 grant teams will present their projects each for about 10 minutes. Then we're thrilled and excited to have keynote speaker and technology strategist Rachel Coldicutt, former CEO of .everyone, to respond to and help put these projects into context. A couple of logistical announcements as well. There's a Q&A box at the bottom of your Zoom screen. We'll have plenty of time for questions at the end, so if you just put your questions in there, we'll be sure to put them in the queue for the end. And second, the grantees are releasing their projects and products live, so if you check the chat box, the links to the products and further information will be provided. So I'm thrilled to introduce our first set of grantees, Tommy Shane and Pedro Noel. They come to us from First Draft, which is an organization that aims to protect communities from harmful misinformation. Their project, the Data Deficits Dashboard, focuses on building a tool that maps out the demand and supply of credible COVID-19 information in order to better track misinformation and develop effective policy solutions. So in order to learn more about their projects, we'll turn it to them. Over to you, Tommy and Pedro.
Hello, everyone. Hopefully you can see my slides, and yeah, I'll begin. So thanks so much to the Aspen Institute for hosting this webinar today, and for everyone here who's joining us. I'm going to talk a bit about our project around data deficits. I'll talk a bit about what that means, and I'll be passing over to my colleague Pedro, who'll be talking about the dashboard that we built to monitor them. So I'm Tommy Shane. I work at First Draft, which is a company that tackles misinformation globally, and I'm head of the impact and policy there. And what I want to talk to you today is about a concept called data deficits, which is related to misinformation. So in order to explain what data deficits are, I want to roll back the clock to the 25th of January, earlier this year, when questions began to emerge about how it was possible that the word coronavirus was on the back of Dettol bottles. And for those who don't know what Dettol is, it's an antibacterial spray. So these were the kinds of posts that emerged in relation to the labels, because if you can see here on the slide, the word coronavirus featured on these bottles, even though they were from 2019, a long time before the coronavirus struck. Now, these posts might seem kind of harmless, but what they did is they contributed to a narrative that people knew something about coronavirus. People knew what it was, that maybe there's something that people were keeping from us, that they're not telling us. And this is exactly the kind of rumor and speculation that can drive conspiracy theories. Now, more important than that, we also know that some people thought that maybe if you could just glug down a bottle of this, you might cure yourself. And obviously these are very harmful and dangerous speculations and questions that people inevitably ask after a crisis strikes. Now, it wasn't until 3 weeks later, on the 17th of February, that Full Fact, a fact checker in the UK, was able to fact check this claim and to provide credible information to say that there is no evidence that Dettol can help. So what was this? Like, what was this period of time, this situation? People wanted to know about Dettol. It was kind of very high vulnerability around asking this question and getting the wrong kind of information. and then a delay, the delay before credible information came onto the scene to answer these questions. Well, this was a question that we wanted to tackle, but there wasn't a really clear conceptual framework or a term or an idea to really tackle this. So what we wanted to do was to think about the infodemic and credible information in terms of demand and supply. So on the one hand, you have demand. So what do people want to know about right now? In the case of Dettol bottles, it was, can it cure coronavirus? Did they know about it before anyone else did? So that's the demand for information. And on the other side, we have supply. So the supply of credible information, in this case, in the form of a fact check from Full Fact. And what we saw here was that we had a high level of demand to start with, but we had low levels of supply of credible information. And there was a disparity there. And what we wanted to do was to try and target that problem. So we have high interest, but low supply. And this is what we're calling a deficit, high levels of demand and low levels of supply. Now, this might all sound very theoretical and abstract and like, okay, great. Now you're just calling, you've got all these terms, you've got all these words, but why is this actually helpful for anyone? And the reason is that when we think about demand and supply, we create this new framework to think about different signals, some data points that we can monitor in real time to start to understand where these vulnerabilities, these risks are emerging. So let's take a look at demand. So demand is, what do people want to know about right now? So now we can start to ideate what signals out there on the internet can help us answer this question. What do people want to know about right now? So we've got, what are people searching for on Google? That can tell us something about what people want to find out about. People searching for on social media, what people are trying to learn about on Wikipedia. What do people really care about enough to petition the government about? What pages are people viewing on government websites? What social posts are going viral, more obviously? What narratives are becoming popular in the press and online. So there's a whole set of metrics that we can start to monitor in real time. And if we look to supply, what credible information are people accessing, we can again look at a whole different set of metrics. So what fact checks are people accessing, what research papers are out there, what news stories are being published, what's the WHO and other medical bodies saying, what government statements saying. And so when we have this new framework, we can get all these different metrics for the demand side and the supply side, and we can start to bring them together and then say, okay, well, look, where are we finding instances of really high demand and really low supply? And that is where we need to act. So this was the real question that animated our project. Where are these deficits and how can we try and monitor them in real time? And in order to put this whole conceptual framework into practice, we wanted to build a prototype dashboard. And my colleague, Pedro, will explain a bit about how we actually did that.
Thank you, Tommy. Hi, everyone. Thanks again for joining us. So we decided to build this dashboard in order to help people to visualize these deficits and deficits of engagement and the distribution of debunks. Can you pass to the next slide, Tommy, please? So we decided to use a limited array of indicators to calculate this demand and supply during this fast sprint. So for demand, we decided to use indicator related to Google searches. So for that, we used the indicators provided by Google Trends. As also we used indicators based on top articles on Wikipedia filtered by language. For supply, we used fact checks as an indicator of credible coverage on COVID-19. Next slide, please. So in total, we gathered 9,722 debunks in order to provide us indicators regarding supply. These debunks were extracted from 3 sources: IFCN, which is International Fact-Checking Network, those organizations filling the claim review, and Full Fact, debunks from Full Fact, which we extracted from the Full Fact's native API. So it's around, the dataset comprises around 7,000 debunks from FCN, 2,000 from claim review, and around 80 from full fact. Now we wanted to categorize these debunks in terms of topics. So we worked with the University of Sheffield in order to use their machine learning model to categorize and assign topics to each of these debunks. The typology we used was based on the typology proposed by the Reuters Institute of the University of Oxford in a report they published in April this year. You can go to the next, yeah. In order to gather indicators for demand, so we used Google Trends API. So basically we calculated the average of interest on coronavirus, on the term coronavirus, in the past 48 hours. So as I'll show later, there's a live display of these indicators in the dashboard, and also a display related to the current and actual indicator for these searches related to coronavirus. As for the top articles from Wikipedia, we used the native Wikimedia API in order to gather the top 10 most read articles on Wikipedia. The dashboard itself is comprised by 4 sections. The first section is a map where you can have a geographic visualization on where these data deficits are, the engagement deficits are, and indicators about the search interest, the total engagement these debunks received, the average engagement for these debunks, and the final total number of debunks assigned to these countries. The second section is a breakdown per country of top searches on Google, extracted from Google Trends, the most read Wikipedia pages in the native language of this country, and also a breakdown of the top fact checks that circulated in this country. Third section is about which fact checks resonated most. So you can have a breakdown of the fact checks, the organization publishing these fact checks, the topic of these pieces, and the engagement these pieces received. Fourth section is about, it's a breakdown of the countries. So it's basically a display of the number of fact checks that circulate in this country, the indicator of data deficit of this country, total engagement of these debunks, the engagement average, and the engagement deficits. All this, again, is filterable by topic. Yeah. So if you want to see and access what we did, you just go to this URL, which is datadeficits.firstdraftnews.org. There also you'll be able to see the whole report we published with the explaining like the methodology we used in detail. So this is the URL. So just to finalize, just like a few remarks on what we learned during this process. First, that managing such a high volume of supplies is hard, not only due to the logistics of managing such amount of data. We had like a hard time deduplicating debunks. We had issues with the annotation of these debunks performed by the organizations, by claim review, by the fact checkers themselves. Also, we faced issues related to API limits, for example. So when we were trying to extract metrics from these debunks, it was very difficult to do this in a quick way, because most of the APIs, they have time limits, which sometimes block or make the process more difficult. Also, we don't have the right signals from social media platforms, because as we stated in previous pieces published by First Draft, the social media platforms, they're becoming search engines as well. And there is no actual metrics, or we don't have access to what people are searching in these platforms, right? Like the indicators provided by the platforms are very centered on interactions and not specifically in what people are searching there. Finally, we need to better understand how the information provided by Google Trends. So although you can use, for example, some operators to perform queries on Google Trends, Google Trends does not provide a fully Boolean friendly method of search. So we faced issues on querying for specific terms. We were obligated to query for the coronavirus as a general term to evaluate all this. So these are the few remarks about what we learned in this process. That's it. Thank you very much. I hope to be able to reply to your questions very soon. And back to you, Mai.
Wonderful. Thanks so much, Tommy and Pedro. Between the upcoming elections here in the US and some of the misinformation we've seen already from the COVID pandemic, figuring out how to measure sort of a nebulous concept like misinformation or data deficits is a key step into figuring out how to combat it. So we really thank you for your work. Just a reminder for the audience members, if you have any questions, to please submit them in the Q&A box below. And also check the chat function for links to the actual dashboard that Pedro and Tommy just discussed and some of their reports. Next, I'd like to introduce our second grantee of today, Pedro Michelucci of the Human Computation Institute. The Human Computation Institute is a nonprofit innovation center dedicated to the betterment of society through novel methods that leverage the complementary strengths of networked humans and machines. Pedro and his team are developing an app informed by epidemiology and behavioral science to help people reduce COVID-19 transmission by making informed decisions about where and when to run errands. And we'll be learning more a little bit more about this project from Pedro. So over to you.
Great, thank you, Mai. And frankly, I think you said everything I was going to say, so we can just stop right here. As Mai said, my name is Pietro Michelucci. I lead the Human Computation Institute, where we develop and build crowd-powered systems to tackle societal problems. So for example, we created an online game called Stall Catchers that now has 30,000 players, speeding up Cornell University's Alzheimer's research. So when COVID-19 emerged, we started to brainstorm about whether we could somehow apply these same methods to reducing the impacts of the pandemic. And we came up with an exciting idea. So we were thinking, where do people go when they're social distancing? Where do they still have to go? So to the store, to run errands. So we had this idea that when lots of people all go to the same store, the infection risk is higher. And if we could evenly spread people out across stores, maybe we could reduce virus transmission. So we did some napkin math to see if the numbers work out. So if you take 9 people, put them all in the same store, each person is exposed to 8 other people, each of whom could already be infected with COVID. So that's 72 different ways that infection could spread. But what if you had 3 stores and you could distribute those same 9 people so that there were only 3 people at each store? Then each person would be exposed to only 2 other people, which adds up to 6 ways infection could spread in each store, or 18 total infection opportunities. So spreading people out evenly resulted in 4 times fewer infection opportunities. The napkin math confirmed our intuition, but the next question was, how do we get people to actually do that? And we realized that given the option, some people might drive a little farther to reduce their infection risk by going to a less crowded store. And the easiest way to provide that information might be a navigation app like Google Maps, where people could see infection risk color-coded directly on the map as green, yellow, or red to indicate the crowdedness of each store. So by this time, we had this tantalizing idea and a possible way to make it work. But we were also mindful of the Hippocratic oath, first do no harm, because we know from experience that even with the best of intentions, things don't always work out the way we expect them to. There can be unintended side effects and feedback loops, and these things only show up when a system is deployed into the real world. So before unleashing CrowdMeter, we want to understand if there are circumstances in which it'll cause more harm than good, or in what situations it could be most effective, and then use those findings to inform our specific design to ensure CrowdMeter is built and used in only beneficial ways. So for example, if only a fraction of people are using the app, it could really help them. But if everyone uses the app, it could potentially backfire. So if they all rush to the safest store, then it suddenly becomes the most dangerous store and everyone there gets infected. And to make things even trickier, this situation could arise due to a media feedback loop. So if the media reports on rising infection rates, then we could suddenly see an increase in CrowdMeter adoption, possibly creating this kind of overload situation. So how do we figure out how to do no harm without putting people at risk in the process? So as a start, we run simulations, which are basically computerized mock-ups of the real world that capture the important parts of what we want to understand. There are many COVID simulators already out there, but our simulations are more complex and have unique requirements because we're trying to understand what happens when you introduce an online app that impacts how many of these different systems interact with each other. So we have a model of human decision-making behavior that balances risk aversion against the burden of traveling farther, a model of the virus, a model of disease spread, population flow model of human movements, and a model of how CrowdMeter would work. But simulations are only as good as their underlying assumptions, garbage in, garbage out. So we gathered a team of specialists to help ensure that these 5 interacting models approximate real-world conditions. With kind support from Aspen Tech Policy Hub and a donation of Azure Cloud Computing time from Microsoft, we built a CrowdMeter simulator to help us test and refine the CrowdMeter concept before we go live. And this is what the simulator looks like. So this grid represents a hypothetical town. And then the 3 big dots are grocery stores, where the color of the store tells how crowded it is. And the tiny dots are people. So green people represent healthy and red people are infected. And then any dot with a little black outline around it is a simulated person that's using the CrowdMeter app. Since our main goal is to flatten the curve, the first question we ask the simulator is whether or not CrowdMeter can actually do that. So flattening the curve doesn't necessarily mean reducing the overall number of people who eventually get infected by COVID. It means to slow down the infection rate so that our healthcare system does not get overloaded and people who get COVID can actually have better outcomes. And until we have a vaccine, this is our best option. And even with vaccines, it can still help. So we ran our simulator with a range of CrowdMeter adoption levels. And the first thing we noticed is that with more people using CrowdMeter, we were actually seeing a more even distribution of people going to different stores, which is exactly what we'd hoped for. Next, we looked to see if the curve got flatter when people were more evenly spread out over stores. And we were quite surprised to discover that it didn't. But we soon realized that our initial assumption of 10,000 people sharing only 3 grocery stores in our simulated town resulted in a very high person density at all 3 stores all the time. This meant that even when people went to the safest store, they were almost certain to become infected. So in that circumstance, using CrowdMeter to distribute people evenly across stores gave no advantages. But when we adjusted the population size in our simulator to real-world values, about 1,000 people per grocery store, we saw exactly the kind of curve flattening we expected. So CrowdMeter was working, and so then the next question was, if it can work, is there such a thing as too much CrowdMeter? So we ran more simulations at very high adoption rates, and we discovered that infection rates do start to go back up, which made us realize there could be such a thing as a CrowdMeter overdose, where adoption levels could get so high that we start to see an opposite, or what they call a paradoxical effect. So we thought the reason this happens is due to the travel delay between when people decide to go to a store and when they finally arrive, by which time the store could be more crowded. So this made us wonder how data latency, which is the freshness of the CrowdMeter information, can impact how well CrowdMeter works. And this is important because the population flow data sources available to us for the CrowdMeter app are not perfectly real time. There are some delays. So we decided to test this explicitly again by looking at different levels of data freshness to see if CrowdMeter could still be helpful even if the data were not perfectly real time, but instead near real time. For example, what happens if the CrowdMeter data is 15 minutes old or 30 minutes old? How does that impact the flattening of the curve? And we discovered that with moderate data delays, CrowdMeter could still be helpful. But beyond about 40 minutes of delay, it could actually increase infection rates. So observing in our simulations that the combination of high adoption levels and data delays could actually make things worse, we set out to examine the full space of those conditions to get a better sense of where CrowdMeter would likely be helpful or harmful. And this set of simulations revealed a safety zone, depicted in green here, and a danger zone in red for operating CrowdMeter. Now, all the simulations so far were based on COVID-19, but we hope that CrowdMeter could be used in the future to help attenuate the spread of other viruses, such as influenza. But each kind of virus has its own characteristics. So we set out to also simulate the impacts of CrowdMeter on viruses with different levels of infectivity, and discovered that for COVID and influenza, it could be most effective, and possibly for the common cold. But for highly infectious diseases like the measles, even CrowdMeter can't contain the spread, and situations like that will require strict quarantines. So what do all these findings mean? Well, we learned that under certain extreme conditions, CrowdMeter would not help at all. For example, when there were too many people in all the grocery stores, when there was an unusually high ratio of people to grocery stores, which could happen, if half the grocers shut down suddenly, or when the virus is highly infectious, such as with the measles. But the good news we discovered is that for the current virus, COVID-19, and the typical conditions found in most places, CrowdMeter will flatten the curve. We also learned that CrowdMeter, like any intervention, has a therapeutic range. For example, antidepressants can actually worsen depression at the wrong dose. So similarly, if we think of CrowdMeter like an anti-pandemic pill, we've observed a similar paradoxical effect where increased adoption is beneficial up to a certain point, after which it can actually cause harm when data delays are present. So what's next? So that green area in the final graph represents CrowdMeter's therapeutic range. And so our next step is to release a pilot version of this app in a context that falls within the safe green area of that graph with participants who voluntarily and knowingly agree to contact tracing, so we can test our assumptions and simulation outcomes against a real-world implementation. And then we'll use those results to fine-tune CrowdMeter before releasing it into the wild. We also intend to run new simulations to test if CrowdMeter could be even more effective by evenly distributing store visits, not only between stores, but also at the same store over different times of the day, and then use artificial intelligence to predict population flow to make that work even better. We're encouraged by these results, and with CrowdMeter safely deployed, maybe we can more easily create a new normal that we can all live with. Thanks. Back to you, Mai.
Wonderful. Thanks so much, Pedro. I am thrilled about your project, and it's really inspiring to see how we can build tools to help all of us make small behavior changes and do our part to reduce virus transmission. So thank you for all of your incredible work. I'd next like to introduce our keynote speaker for the event, Rachel Coldicutt. Rachel is a technology expert and strategist who specializes in the social impact of new and emerging technology. She is the former CEO of .Everyone, a UK-based responsible technology think tank, and as CEO, she led influential and groundbreaking research into how technology is changing society and helped develop practical tools for responsible innovation. Prior to that, she spent almost 20 years working at the cutting edge of new technology for companies, including the BBC and Microsoft. I'm extremely excited to have Rachel share some thoughts on what's been presented this morning. Over to you, Rachel.
Hi. Well, I mean, it's been amazing to see these two projects and think about them in the context of some of the work that I have done over the last 6 months. And I think the two bits of context that I can bring to that is both the work I've done around public trust to do with technology at this time, and some research to understand kind of how communities are using technology and how that is changing behavior on the ground. And I think the first thing I would say, from my perspective here in London, is that we're in a really extraordinary moment relating to data. So data is normally something that moves around fairly invisibly. People don't talk about it a lot. And in the last 6 months, a whole load of ideas and concepts about data have become things that everybody is talking about all the time. We've heard just now about flattening the curve. There are people who've never really looked at a graph in their life who are now talking about log scales and exponential growth. We're all interested in the rate. And it's this kind of weird world in which we're all suddenly fascinated by and experts in things we don't know anything about in a context that we don't understand. And I think both of these projects that we've seen are really interesting in how they take the uncertainty and the multiple uncertainties that everybody is living with at the moment and find hooks for us to hang particular activities on. Because I think as well, one of the things that's come up in research that I have been doing is that although this is an extraordinary time in that, you know, this terrible virus is affecting everyone all over the world. Many of us are at home alone. Many of us are alienated from communities where we would often find knowledge and get context. And yet there's information that is available to us all the time. And the role of trust in this, I think, is really important. And so to go back to Tommy's presentation, thinking about how does anybody know where any information has come from? Here in the UK, where I think we have a very different relationship to the state. Until maybe the start of the pandemic, I think we saw like a relatively benevolent relationship between individuals and the state as a whole, with quite high levels of trust, quite high levels of trust in the information that was given out. And that actually one of the things that has happened here in the way that technology has been used is that rather than speaking to the kinds of openness and transparency we've heard about with these two projects, rather than kind of using the best of technology, which is really about openness and interoperability and democracy, there's been a tendency in governments, I think, all over the world, but particularly in the UK, to think of data as a black box, to not explain it, to not empower people, to spit figures out and to change the rules. And I think the things that are really interesting about these two tools that we've seen today is that in different ways they give us more autonomy as individuals and communities. One of the really complicated things that has happened in this period is the idea that, having been individualized over decades and decades by, you know, markets and capitalism and housing and all those things, and then again by our the phones, that actually we're being asked to act together, but potentially we don't know how to do that. And I think a tool like CrowdMeter is really interesting because it kind of helps us all kind of lean on reliable external information. I know at the moment people find it very difficult to work out what to do next, how to navigate advice that is changing all the time. And I think the mixture of being able to visualize and being able to get local information is probably really helpful there. And I'll just speak quickly to one the finding that came out of some work that I've been doing over the last couple of months, looking at how communities are using technology. And one of the things that came out a lot is that mutual aid is both great and it has a downside. And so the thing that we saw is where there is not an existing community, where people are not already talking to each other, where there is no one to host, where there's no one to kind of build the capital in the group. When mutual aid has appeared in a community mediated only through technology, it's been much harder for people to ask for help because they haven't had those bonds that tie them together with the people around them. You know, it's easy to offer help on an app, but it's much harder to ask for it. And I think that, you know, the thing that makes me feel quite hopeful about both of these projects is that they're not trying to change how many people behave at once. They're not trying to sort of bite off, you know, a whole system, but they kind of speak really well to the kind of technology that can be deployed and used responsibly. Small parts that are adaptable, connective, can be loosely joined with other things. In Britain, I think, as I was just saying earlier, we're a much smaller country, you know, and I think there's an idea that it is possible to create an enormous end-to-end system that will solve all the technology problems and all the people problems. But actually, going to an idea of small parts loosely joined, where people and communities can take the things that work for them, where they're monitored and measured and adapted over time, feels like a really positive route ahead as we navigate whether it's a year or two of the coming uncertainty. And I think those kinds of tools will help us all behave in ways that can help each other as well as ourselves. Thank you. Over to Maya.
Wonderful. Thank you so much, Rachel, for those remarks. I agree that it's important to think about the context we're in and how it relates to our projects. And in a time where public trust in information seems to be at all-time lows everywhere in the world, and especially here in the States, building tools that improve trust and give information to the people to inspire behavior change in some way might be an incredible policy lever. So thank you again. Another thing that I feel inspired about by today's projects is that they give practical solutions to the issue of providing more information and improving public trust, which is incredibly difficult. So we've tried to bring about some practical solutions today to improve information sharing. But if there's anything that we'd love the audience to know here at the Hub is that there's plenty more to do, and that there's plenty more that we can do as engaged citizens. So now I'd like to bring back the panelists back up to answer questions. Again, another reminder that you can submit questions in the Q&A box below. So the first question is for Pedro, and this comes from the audience. So CrowdMeter is a fascinating project, but this problem of sort of many people rushing to one location must be a problem that Google has looked into in depth with things like Google Maps and routing software. Are there any insights here that are transposable?
Yeah, that's a really apt question, I think. So it's a really fun problem space to kind of geek out on, and we're definitely mindful of techniques like rerouting, either implicitly or explicitly. So people will potentially look at the app as they're going to the store to see if the situation's changing, but we still have this potential data delay problem, and so I think we're certainly gonna look into Google's findings on this and probably from other sources as well. But I think a couple relevant approaches here. One is that our simulator is a computational model. So we actually represent each person moving in this town and going to stores. And when we slow down the simulator, you actually see people driving to the stores, and it really helps to sort of develop an intuition about how behavior changes under certain assumptions when you tweak the model. And so this is a computational model, but then once we get those insights and we get results, we can then transform that into the more typical form of these models, which is differential equations, which is much more efficient and what most COVID simulators use today. And I think part of it is to appeal to complexity science, which helps us identify kind of how different equilibrium states arise. And then when we tweak the model, can we achieve the target equilibrium state where you don't get that rushing in effect? And then I think finally, we're going to explore predictive modeling. So the idea is, can we anticipate when we provide this information on CrowdMeter at these level of delays, how are people going to make decisions about where to go? And if we know that, then how does that maybe shift our recommendations? Or something like that. But it's very much a chicken and egg problem, which is what complexity science is perfect for. So back to you, Maya.
Wonderful. Thanks, Pedro. The next question is for the First Draft team. So what might be other sources of supply other than fact-checking organizations which inherently have limited bandwidth? And this comes from Spencer Yen from the MIT Media Lab.
I can take this, Pedro, let me know if you want to jump in. Well, I mean, this is precisely the kind of question that we can ask through this framework and this approach. So I'm really pleased to hear you thinking about that already. And I think, yeah, it's an open question. It's in a way, it's for all of us to think about how we might answer. The ones that we've been thinking about, other than fact checks, because you're completely right, there are constraints on resources, and also fact checks are only a particular kind of information coming from a particular kind of organization. So other options are things like research papers or preprints. We saw a lot of information coming there in the process of the pandemic this year. We could also look to news reports as well. If we look at credible news sources, often these are very early to strike with credible information, and is the kind of information that reaches people as well. Because when we think about supply, it's not just a question of whether the information is created, but it's actually got to reach people. And that's where the news becomes so significant, because they tend to have a much bigger reach than fact checkers. And obviously then you get into questions of TV. Are information getting carried to people on TV that might not be so easy for us to scrape online. But the news is definitely a big source. Government statements tend to be fairly well researched. That's another place that people might look for information as well. And it might be the kind of information that flows into other sources like news and fact checks and so on. So that is another place for us to look. Civil society as well, think tanks. It might be that certain charities are providing good information. We've got an organization called Citizens Advice in the UK that's very transparent with its data and also provides really credible information. That's another group to look to. Medical bodies, the WHO, they were doing a lot of, they're really trying hard now. I think they've even got a new job role called infodemiologists, who are designed to look at this kind of information, and they were providing a lot of the kind of information that's sourced. So that's just a kind of a quick overview of possible options. But I think what I find most productive and I suppose exciting about this route is that it helps create this framework to start asking those kinds of questions, like how would we gather all this information to have a picture of what people are accessing, what credible information people are accessing. So yeah, if you have any other ideas, tell me, because we will definitely steal them and implement them. I don't know whether you have any other thoughts, Pedro.
No, I think it's pretty much this. Just to flag that there are projects that try to both automatically and manually attribute bias or credibility scores to news sources. But again, this is extremely problematic, right? Because it's very difficult to list all the available news sources and then perform objective evaluation of their bias and their credibility. So again, it's an open question.
Wonderful. Thanks so much, Tommy and Pedro. Pietro, we have another question for you. So a Crowdmeter app would likely draw a lot of excited potential users. How would you control adoption levels so that the app can stay effective in the green safe zone?
Yeah, great question. Yeah, it reminds me of this commercial during the .com boom where everyone's sitting around, their new website goes live and they're excited. And back then we had these site visit counters and it starts to go up and they get excited and then it starts to go up faster and then they start to look at each other and pretty soon it's spinning out of control. I think, our idea is that if we can implement prediction in the model so that we can mitigate the effects of delayed data, then the adoption rate issues go away. So in other words, in a perfect world with instantaneous data or perfect knowledge about what people were going to do and where they were going to go, Crowdmeter would work great with 100% adoption. So obviously we don't live in that perfect world, but I think from our model of Crowdmeter today to where we think we can go, I mean, this is just the very earliest, sort of most rudimentary implementation. And I think the sweet spot for this one is 20 to 40% adoption. Well, if we can get 20 to 40% of the people, in the world, in the US, in any country to use this, that's a huge adoption level for any app. And I'm optimistic that with the experts I'm working with and the methods we're using, that we could support a much wider green zone that encompasses a much higher adoption rate as we implement these new methods. And that's what we're going to be testing out in simulation as well. Back to you, Mai.
Wonderful. Thanks so much, Pietro. Another question for the first draft team. So your project is identifying data deficits, but what comes after this? That is, how do you think this project will inform first draft's other misinformation fighting methods, and what are solutions that come out of this?
Well, That is a great question. I mean, this was born in the context of a pandemic. We are not so much in that immediate post-crisis phase anymore. So there's a couple of things for us to think about when we think about taking it next. First of all, how can we be better prepared for the next crisis? I was reading recently that there's a prediction that we'll have a similar kind of health crisis, maybe not on the same scale, but something like it every 5 or so years. So I think one of the questions is, what can we have set up in place so that we are better prepared for the next crisis? The second route is, well, outside the context of crisis, how can we make this useful? And I think the answer to that is by looking at specific subjects, specific topics. So the key thing that we're looking at the moment is vaccines. Obviously, that's the next phase of this infodemic, as it's been called. So what we want to do is break down vaccine conversations into subtopics so that we can track them more precisely, and start to use these kinds of metrics that we've talked about today to understand what information people need, and then connect with information providers to help fill that gap. So it might be, it could be fact checkers, obviously, it could be social media platforms, it could be communication agencies working with government bodies like the UN and UNICEF. It could be influencers. I mean, they're a huge vector of misinformation at the moment, so we could be trying to help influencers on Instagram and different social media platforms like that answer the questions that their followers are likely to have, and be a credible information source for those people. So I think, yeah, what we're most likely to be looking towards is how we can break this down for different topics, monitor these conversations closely, and then connect with the right people to provide, to fill those gaps, to kind of address those deficits.
Wonderful. Thank you, Tommy. Rachel, I have a question for you. So you spoke a lot about the importance of giving the public information, and these projects are about crowdsourcing information. Do you have any insights on how we can use tech to facilitate crowdsourcing information without some of its negative consequences, like misinformation popping up?
I mean, I think, oh, gosh, it's complicated. I mean, just to go back to what Tommy was saying, I think one of the really important things here is to look at topics in their context. And I think at the moment, it may be less about I think it may be more about building the ability to trust and to question. And I think almost making a culture in which it's okay to say, I don't know, I don't understand, I need help. Because I think potentially one of the downsides of all this information is that it feels like we all ought to know. You know, and back to what I was saying previously about how everybody's now an expert in data, or an epidemiologist, because we've read about it on the internet. Like, I think actually where I would go is make it much more about the critical skills and the confidence to say you don't know, rather than making it be about collecting more and more information, if that makes sense. Thank you.
Yes, that definitely makes sense. Thanks so much, Rachel. So we always like to ask one last question here at the Hub. So if you had a one-line bumper sticker, what is the main takeaway of your project in one line? So I'll go in order of our panelists of how they show up on my screen. So Pedro, what is the one-line takeaway of today and your project?
Okay. So I mean, I think nobody wants to get sick from COVID, but we all, I think, value our autonomy and transparency of information, and we now have evidence that CrowdMeter can help reduce the impacts of COVID by keeping us all informed of our options, so we can achieve a new normal that we can hopefully all live with.
Wonderful. Thanks, Pedro. Tommy, what is your one-line takeaway?
My takeaway would be that information is a public utility. Like, we depend on it. Our lives depend on good information. And as a result, we need to find ways to monitor it, just like we monitor other things that we rely on. You could compare it to something like water or the weather or money. Like, we need to be able to monitor these things. And the thinking in terms of demand and supply is like one entry point into trying to do that.
Great, thank you. Pedro?
I would say that, I mean, the territory that we're navigating here is still very unknown, and we are still in the first steps of understanding how information is relating with global health crisis.
Wonderful, thank you. And Rachel?
I have spent a lot of the last 6 months kind of looking at the ways that technologies aren't helping, looking at, the problems of the surveillance, the loss of the privacy. And I think the thing I would take away from today is that it's like really hopeful that actually it's really great to see practical, realizable things that are being thought about responsibly, rather than not all technology has to be about total the surveillance. And so that's really optimistic. Thank you for that.
Wonderful. Thanks for ending on the optimistic note. I always appreciate that. So I just wanted to, before we end, I wanted to thank first the funders that made these COVID challenge grants possible. So that includes the Ford Foundation and the Omidyar Network. I wanted to thank the Aspen digital team here at the Aspen Institute that have been working behind the scenes. So that includes our director, Betsy Cooper, Meha Alawalia, Sevilla, Karner, and Javier. I, of course, want to thank the grantees themselves, Tommy, Pedro, and Pietro. I want to thank our keynote speaker, Rachel. And I also wanted to remind you all that our next and last webinar of the series will be on Wednesday, October 21st at 9 a.m. Pacific time or 12 p.m. Eastern time. So we'll be presenting on our last 2 grantee projects focused on informing COVID response and communications through tech. So we'll be hearing from Michael Morrissey from Muckrock, who will be presenting a product that helps quickly scale efforts to collect and analyze data needed to inform policy and community responses to the COVID crisis. And we'll also be hearing from Brendan Lind of Human Agency, who will be presenting on a responsive messaging service that helps connect individuals to specific resources in their communities. So I hope you all will join us. And in the meantime, we wish you the best in these difficult times. Thanks so much for joining.